In this episode, multiple myeloma survivor Otis and his wife and care partner Tracy share their path from a delayed diagnosis to CAR T therapy and remission, highlighting the power of self-advocacy and informed decision-making. Together, they explore the critical role of care partners, the importance of building a strong support network, and how asking for help can be life-changing for both patients and care partners.
Hello, my name is Otis Wilson. I was diagnosed with multiple myeloma in December of 2017. I had I'd been dealing with symptoms for a couple years, having lower back pain, and I had gone through all kinds of therapy. I got put on a machine where they stretched me apart. I ended up getting lower back surgery as well to alleviate the pain. I had sciatica down my right leg, and none of it seemed to work. And what ended up happening was in August of that year, I actually had gone on a trip with some friends of mine to the Dominican Republic, and I caught salmonella poisoning in the Dominican Republic. So I made it back home, and we were on our way to church on a Sunday, and we decided to stop at the hospital at the emergency room since I wasn't getting any better. So while at the emergency room, they tested my blood cells, and they said my numbers were very, very low. But they told me that it was probably nothing to worry about. It was probably because of the infection from the salmonella poisoning, but they wanted me to follow up with my primary care provider. Well, that next week, I followed up with my primary care provider, and my numbers were even lower. And at that time, I got a referral to hematology oncology, and from that point in August until December, I went through every kind of testing there is to diagnose me, and even got a second opinion at Vanderbilt. And in December the 26th, I believe it was, they let me know that I was testing positive for multiple myeloma. So I had actually relapsed in 2023. In December of 2023, I relapsed, and they started me on another regimen, and that gave me relief. It brought my numbers down somewhat, but not all the way, and they started to go back up again in around the May time period. So from December to May, I only got relief for that long. And I had a discussion with my doctor. Actually, I asked my doctor myself about getting CAR T and what would be the advantages of that. And at first, he wasn't really bought into doing it, but I convinced him that it would be a good choice for me, and he eventually agreed that it would be a good choice for me. So I started my journey in August, and I ended up getting Carvicti in December the 6th of 2024. It's about keeping in touch with people and letting them in to activate your network. I would say that I have a very, very extensive network myself of friends and family and stuff. I have friends that came in from out of town to stay with me at the hospital. When Tracy couldn't, I have friends that literally would drive me to and from my doctor's appointments. I have more than one friend that did that for me. So activating your friend network is very, very important, and I think staying in touch with them is the most important thing.
Asking for help. I think that can sometimes be, to the detriment of not only the patient, but for the caregiver. The patient doesn't necessarily acknowledge or say that they need, help. The caregiver thinking that they are the Superman or Superwoman, that they can do all things and do everything and be everywhere doing, everything at all times. That's just not physically possible. So I think the best thing and the self-care thing to do for both people is that you activate your network, that you activate your community, that you ask for help, whatever that help may look like. If it's from something as simple as just, call and check in, a prayer, or if it's meals, or if it's childcare, or if it's washing clothes, whatever it could be, but just asking for the help to help alleviate some of that load so that you can have maybe a moment to yourself to take care of yourself. As Otis alluded to, as far as who his team was, who are those unsung heroes, I mean, he was blessed to have a very, very, very extensive community of loved ones, of friends, fraternity brothers. He just was lucky and blessed to have that kind of community that didn't mind throwing their hand up and saying, hey, I can definitely help out, and this is how I want to contribute. I can remember one of the big things that happened when he got his stem cell transplant and we were going to be in quarantine is that one of his fraternity brothers reached out to me and was like, hey, I think I want to do a meal train for you guys. And I know that you're going to be in quarantine, but what's going to happen at the house? And I was like, well, the kids and my mom is going to be still at the house. Well, I want to set up 2 meal trains. And that's exactly what he did. So for the 2 months, we had meals coming almost every day, if not every day, not only to the hotel where we were in quarantine, but to our home. Where our children and my mother and then other friends and family that came in to help my mom with our kids, because our son at that point was not even 6 months old when all this started. And then we had a, 6, almost 7-year-old daughter at that time. So again, friends and family. I would say another unsung hero would be his initial oncologist, because if it wasn't for him, then he wouldn't have been properly diagnosed. I appreciate with him that he looked at the seriousness and he did not want to give the diagnosis until he was sure. And so that's why he sent him to Vanderbilt, because there was his mentor and he was the head of the stem cell transplant program there. And he wanted to get a definitive answer from him before he was totally bought in that it was multiple myeloma for Otis. And he still is a family friend of ours. We still, anytime anything weird comes up, we always reach out to him and he's readily available. He's in Nashville, so he's not even here, but he still loves talking to Otis, making sure that Otis is being well treated. He was the one that actually got Otis into MD Anderson and the healthcare, and Dr. Lee, because him and Dr. Lee was in school together. So he was definitely an unsung hero. I would say another unsung hero would be what is now Blood Cancer United, but previously Leukemia and Lymphoma Society, so LLS as what we knew it by. The resources, the education, the advocacy that they provided, we could never put an amount on what they were able to provide to us. And they were actually the ones that really started getting our voice out there in regards to our story. They have people in all areas that, and we didn't have to take advantage of this, but because of our journey and our connection to them, there was a young lady that had moved here from another country. I was connected to her through a colleague, and she had multiple myeloma. And she was here. She didn't have insurance. She didn't, there was a lot of coverage and access issues, and it was just poor quality of care. And so what I was able to do was to get her connected with, I can't remember the person's exact title, but it was something around education and provider assistance. And what they were able to do, not only get her in with one of the best providers in Florida, but help her with coverage as well too. And then they also have the resources around getting to doctor's appointments, so funds around that, taxi assistance, when you have to go into quarantine, lodging assistance. They have so much assistance available that I don't think very many people really know the vast amount of help that they can provide to you from the beginning and even as you continue in your journey. I would define a care partner as anyone that is showing love, care, empathy, assistance. A care partner doesn't have to be a title, meaning you don't have to be a husband or a wife or a mother or, the parent or the child. It can be anyone. And you stepping into the role to provide assistance to someone that may be going through a health crisis, a health challenge, anything that may be challenging their health, and they're needing extra hands on deck to be able to maintain and get through. For the care partner, and being in the role, the first appointment is probably the most important one. And I feel this way just about healthcare in general, that I think you should always have someone there. Because when you're there in the appointment and you're listening to your healthcare provider and you have this limited amount of time that you're there, then you need someone with extra set of ears, because you're only going to hear what you're basically want to hear, because you're the patient. And then, but you need someone that is outside that can provide that kind of objective lens and can kind of hear a little bit more clear, because they're emotionally tied, but not the same as if you were the patient. And so they can be a little bit more clear-minded on if there's some additional things that need to be asked for or advocated for. They can be the one that can be your voice and speak up for those things before the appointment is actually taking place. I really believe that people should pre-plan. So before this first appointment, you and, patient and care partner sit down together. Think through, what is it that you want to know? What is it that you want to ask?
Mm-hmm.
You don't want to leave the appointment without this information. Have a game plan identified so that when you walk in there, again, the person that is a care partner, they can be the one to ensure that that checklist is actually accomplished, and you don't leave the appointment feeling like you wasn't heard, you wasn't valued, and just feeling very confused. One of our very first appointment that we went to after his diagnosis, it was a lot of tough conversations, asking about advanced directives and things like that. And those were conversations that, we've glossed around. Mm-hmm. But to actually have the real conversation about what you would want in your end of life and how would you want that to look like, that was, even for me as a healthcare provider, shocking to my soul and very hard to deal with. So him as a patient, I can only imagine. So us meeting in the middle and trying to be there for each other on what it is that he would want. I think having those conversations much earlier, so that in moments like this, it's not so shocking to the soul and the spirit.
The overwhelming amount of information that you're taking in is astronomical, and I think to have somebody else in the room to actually hear what's being said, because it's literally going in one ear and out the other, because you're trying to take in everything, and have somebody else in the room with you to catch the little points and the big points as well is very, very important. And I think that's why it is such an important part.
As far as the self-care part, make sure that you're maintaining the care of yourself, I think is just as important as anything else. Otis is the priority, so we're going to make sure that he gets what he needs. I think the other part is that you can't pour from an empty cup. So if you as a care partner have depleted everything physically, mentally, spiritually, everything, ensuring that your loved one is getting what they need, but you don't spend any time with yourself to give yourself something back to fill your cup, then you're going to crash and burn. And that's what I did early on, because not only did my husband get sick, but my dad got sick at the same time. About, I don't even think it was a solid month after Otis was diagnosed, and my dad started having strokes and was diagnosed with vascular dementia. And so, me being the caregiver in the family, I took on the weight of not only with Otis, but also my father. And by March, I'm in the emergency room having my heart being looked at because I'm thinking I'm having chest pain and something going on with my heart. Thank God my heart turned out to be fine, but I still ended up having to have a catheterization to ensure that everything was fine, and everything turned out to be wonderful, and got a lot of great information in regards to my heart. But to have to go through that because I didn't take time to take care of myself, in addition to taking care of my husband and my dad and my young children, that eventually took a toll on me. So now I am purposeful to ensure that I am doing something for myself, whatever that can look like. And that's going to vary from person to person. So I would tell anyone that listens to this that your self-care is going to vary. So if it's just going for a walk, go for that walk. If it is going to get your nails done, go get your nails done. If it's going to play a little golf, go play some golf. Whatever it is, just go do something that actually fills your cup back up. First, you have to get over, I think one of the things we have, ego plays a huge part in it. Me, I got it. I can do it. I'm fine. Move the mental, tricks and dynamics out of the way and just ask. You're going to need help. So whether you're the care partner or whether you're the patient, just acknowledging, where your gap is, where you don't have it, and asking for help in that particular area. And you will be surprised at the number of people that will run to your aid because you asked. For me, even in my own personal health challenges, that I'm facing kind of right now, when people have asked, me, the strong one, when, do you need any help? What does the family need? I paused because initially I was saying, oh, no, we're fine. Oh, and then I immediately, after about the second or third time someone asked me that, I actually said to that person, them on, no, actually, we could use this.